Hello, everybody. Welcome. My name is Ryan Walsh. I'm here today with Ilya Walsh and Kelly Urban to discuss different therapy modalities, specifically centering around DBT. And thank you for coming to the video today. So I guess we're just going to get started, and we're going to get into a brief conversation about different therapy modalities for autistic people, and again centering around DBT.
Yeah, I think though what I'm most curious about is this is a this is an area that comes up and I hear about often. And I will be totally honest that I don't know as much about it as I think I should. And I'm thinking that might be a case for a lot of people because I think we hear the terms like DBT and CBT and EMDR and like all of these acronyms, but we don't really know what they all mean, or we know bits and pieces or just a sliver. So Kelly, I know this is an area that you have a lot of experience in, and you've mentioned it and worked with many folks. So I'd love to hear, I mean, originally, and I guess maybe what we should start with is, Kelly, give us a little bit of background around who you are and how this is important for you and for our folks.
Sure. Yeah. So I'm Kelly, and I've been in the IFS department at AANE as a senior manager. Do a lot of parent coaching and calls with autistic adults and their parents and family members, and then also run a group and kind of oversee some groups. But in addition to that, outside of A&E, I'm a therapist, mental health therapist. So I have a private practice, and the majority of the people I work with are autistic adults. And of those, I use like full DBT or what's called comprehensive DBT with a small number, but when it comes to sort of the DBT informed approach, I would say it's, works, or I use it with everybody, and in my own life, it is sort of taken over as, I can't help but practice it because I believe in the sort of model and mentality so much. And I'll say just as background, I got exposed to DBT when I worked at McLean Hospital back when I was years ago before coming to A&E. And so I was working in a residential treatment program for young women who had various diagnoses, but the commonality was they struggled with emotion regulation. And so they were in a DBT program, so I learned DBT there, and then kind of been using it in my work since.
So my question that I have, in you talked about kind of like the full model
Mhm.
DBT versus like taking parts of it and using parts of it. Like, can you talk a little bit more about how that works and like what that looks like for clients?
Sure. Yeah. So when I say the full model, or I also use the term comprehensive, that's another way that it's described. What that means is that there are four modes of treatment. So it would mean that all four are present. So the kind of mode that most people are familiar with is like the individual therapy session. So they would be meeting with your therapist. It's usually once a week, usually for like an hour, but there's some variability there. And following the sort of, which I can describe maybe more after, but following the sort of steps of like a typical DBT session. So you're using a diary card, to track. The client is using one to track certain behaviors that they want to pay attention to and potentially change. They're using chain analysis to be having that tool to be able to analyze behavior, to understand the function of it. I can say maybe a bit more, but that's the individual therapy piece. Then there's also skills coaching. So that is when a client can access their therapist outside of the session, in between sessions, outside of the session, in order to get help generalizing the skills. So the idea is that people need to learn the skills and kind of learn new ways of doing things because they don't necessarily or haven't necessarily been taught or integrated kind of more effective ways of managing emotions. So they're learning the skills in the other mode of treatment, which is the skills group. But they're getting coaching in the moment from their therapist on how do I actually integrate this in real time, right? Like, because you're in a therapy session, maybe things are going okay or, whatever, but then you're out in your real life again, and it's like, shit might be hitting the fan. So it's like that's a time where it'd be let me text or call my therapist, and they're going to kind of go through, a little bit of a script in a sense of like how you can use these skills in the moment. So it's not another therapy session. It's really about applying the skills. So then there's that. Then there's the skills group. So that's where the client is actually learning the skills. It's more of a class than a group, which I think is a helpful distinction to make, even though it's called a group and it is a group of people. But it's not about like a open-ended process thing, sharing kind of, how you're feeling. It's really like there's a curriculum that the facilitator is following, or the leader is following, excuse me. So you're doing homework, you're really practicing, learning the skills so that way you can use them in your life. So that's the third mode. And then the last one is called the consultation team. And that is a meeting for the therapist. So the client doesn't go, but it's because it's so important that the therapist is effective in their work. And because this work tends to be, challenging, therapists can get in their own way, have their own, what's called therapy interfering behaviors, doing things that kind of interfere with therapy. There's this carved out space for the therapist to support one another, in the spirit of being as effective as they can be. So those are the four modes. And most commonly, I would say someone will say, oh, I'm doing comprehensive DBT, or I do DBT. But really, they're just like maybe talking about some skills with their clients, where they're integrating a concept, like talking about dialectics, which is great. It's not to say that shouldn't be happening, but yeah, unless all four modes are present, it's not considered to be officially comprehensive DBT.
Just real quick, can you define dialectics for those who are not aware?
Mm-hmm. Yeah, definitely. So the D, if we haven't said this already, DBT stands for Dialectical Behavior Therapy. So it is a very important part. Essentially, it means that you're holding at least two things that seem like they can be in opposition, sort of holding them both, and coexisting. So it's like acceptance and change is the core dialectic in DBT, right? Like they seem like they're at odds with each other, sometimes. And really it's about like, how do we allow for both? And that shows up with, our emotions, right? I can feel like, oh, I can only be feeling this, or because I'm feeling this, I shouldn't be feeling this. And it's like, no, both can be true. We can be dialectical or non-dialectical in our thinking, so it's really about the gray, like that gray area, as opposed to being black and white. Yeah, and maybe I'll just add to that the sort of origin of DBT, because I think it's helpful to know. Is that okay if I go into that?
Yeah, yeah.
So I think basically the way DBT started was it came out of CBT, which I think people are more familiar with generally, cognitive behavioral therapy, which is very change focused. It has some acceptance built in, but primarily it's like a very change focused treatment. And a lot of the people who are receiving it initially, who were having like strong emotion dysregulation challenges, they experienced it as invalidating. Like they felt like it was too change focused, like kind of like, okay, if you just change how you're thinking, you'll feel better. And while there is some truth in that, changing our thinking can help us feel better, like it was missing this other piece, which is the acceptance and like the validation. So DBT like intentionally brought in acceptance more strategically, and then recognized like this whole idea of dialectics is really valuable as well. So yeah, in a nutshell, DBT was born.
Yeah, Kelly, can you give us an example? Because I think what you mentioned earlier is that some people will say they do DBT, like a provider, but really maybe they're doing aspects of it, or it's like DBT informed, versus the full comprehensive version of what you described, which seems very intense.
Mm-hmm.
So can you like help us understand like what would be an example of maybe why you would do one version versus another version?
Yeah, sure. So I guess what I would say in terms of why somebody would do comprehensive DBT, given that it is a big investment, it's really, so anyone can do it. There's not like a particular diagnosis, required. It has been linked with borderline personality disorder, because it, is an effective treatment for that. But really, I'd say anyone who's experiencing a lot of emotion dysregulation, really feeling things intensely and having a hard time like, managing it, could be a good candidate. But I think unless it's like really getting in the way of your life, like really interfering with your functioning, I would say not that like you shouldn't do it, but more, I don't know that you would need to invest, so much like to have really, I think one of the big things is like if you're having behaviors, and behaviors can mean in this context, emotions, thoughts, and actions. It's not just what we typically associate with behaviors, but it's sort of things that are happening that are getting in your way and, kind of like wreaking havoc. So, I mean, the most kind of probably common example is like self-harm. It doesn't have to be self-harm, but certainly that's a common one. But suicidality, really struggling, suicidal thoughts and actions. So kind of what typically considered like maybe like out of control behaviors that someone doesn't know how to manage for themselves, like that would kind of lend itself more to a comprehensive DBT model. Whereas, yeah, I think anybody can benefit from the DBT informed just in terms of the sort of principles behind it. But yeah, you really have to be motivated. I guess that's the other thing. Like you really have to have a willingness to do it because it is asking a lot of the person. It's not by any means like a passive, we're just going to talk about whatever you feel like talking about today. It's like, no, you really have to have, things you want to change. And DBT helps lay that out by building commitment and helping somebody identify their life worth living goals. So it's, built into the beginning of the treatment, this pre-treatment phase that's all about building commitment. So somebody really knows what's being asked of them and, is making a very conscious choice to do it. So I don't know. Does that answer?
Yeah, I think so. I think so. And I think you just raised like another question for me is, and maybe these are like all intertwined, but if someone were, like I wouldn't know, I think I worked with a therapist for myself who sort of approached it from a CBT model, and had to explain it to me like what that was, and we used charts and all that. And I did get that sense of, I felt like my experience wasn't being not that it wasn't being valued, but it felt like it was being dismissed in some way. Like, yes, I know that like maybe the past experience has now had puts me in a place that I'm thinking like some of the ways I'm thinking are not helpful, right? So I need to like readjust those. But like, hey, can we first like validate the experience, which is
Yeah.
kind of where I felt like it was missing a little bit. And so I abandoned it for, and I actually changed therapists because of that. But what it brings up for me is like, what is the like as someone who doesn't know what these modalities are, I mean, maybe I'm a little better informed because I work with you all, but like not knowing how would this version of it get like brought up and say like, because I assume most therapists have a variety of tools, right, in their toolkit that they pull out. But when do you know like that this is the right tool or something to explore at least?
Mm-hmm. Yeah, you mean like for the client, right? Like,
Yeah, yeah. Mm-hmm.
yeah, yeah, it's a good question. What would I say? Yeah, I don't have an immediate.
Well, you mentioned like strong emotions and like strong like
Uh,
deeply getting in the way of maybe day-to-day functioning, right? So like can you give like I know it's hard sometimes to give an example of like what have you worked with people on? Because I think when we think, also looking at this in the context of using it, people find success with autistic
mhm.
clients. And so I'm curious like why that connection. And so maybe
Mhm.
that can be a way to like give an example of why it might be helpful for many people.
Yeah, definitely. That helps. Well, I think what I'd say a common reason people kind of find themselves coming to DBT is they'll say, I don't want to do more of the like just talking about like just talk therapy, which, DBT is still talking, like that is the mechanism of delivery, which can be a challenge because it is reliant upon mostly unverbal communication. But I guess the fact that it's a behavior therapy, which I know, it's sort of I guess a loaded term, like in the autism world, so I'm sensitive to that. But it's a behavior therapy, and that is really about trying to activate new behaviors. So of course, again, you're talking and you are, paying attention to things, and you're thinking about things. But at the end of the day, it's really about, how do we look at the function of, so like, let's say, I guess if it's okay, I'll use the self-harm example because that's such a common one. So somebody is self-harming, oftentimes they don't necessarily know exactly why, or what it's doing for them. But if the idea is that like there is a reason, right? There's like a reason we do the things that we do. It's serving some purpose. So it really is about being like a bit of a detective, you and your therapist together and say like, oh, let me try to understand this. And that's where the chain analysis comes in, which is just like plotting out, what is everything that happened leading up to this, right? Like we're working backwards to try to just be curious, right, and non-judgmental, which is of course challenging a lot of times for someone to do with themselves. But those are skills you're trying to build, and really paying attention. So building your mindfulness skills, to better understand like how did I get here? Because things, as we all know, I think can happen so fast and feel like just chaotic, and we can't always tease out. We just know, hey, this thing happened, and now I'm having more problems as a result, right? Like, so Yeah, I would say if somebody feels like nothing is really changing in life, like they want or they recognize that, hey, I have some kind of behaviors or some tendencies that seem to be getting in my way, but I don't really know, I've been talking about them, but it doesn't feel like anything is really different. The way DBT approaches it, not that it's the only behavior therapy, but it does it in a very, strategic way. So I think that's what I would say. I think there was one other thing I was going to add. I guess just again going back to the idea of in emotion dysregulation, like that being the core feature. But for some people, that manifests outwardly or externally, and other people it's more inward, like like an intense shutdown. So it doesn't have to be like, okay, I'm doing all like the stereotypical things. You can still be experiencing extreme dysregulation and not present, maybe because of masking or other reasons. So I think it's a lot about like somebody understanding what's going on for them. But more likely than not, maybe another person might point it out and be like, hey, I think you might benefit, from DBT, right? Or like, I know that these things are happening. So like maybe DBT, would be something to look into. Yeah.
Yeah, I think you
Um,
wrote Oh yeah, go ahead, Ryan.
I was gonna say, I think that I want to ask one more general question about DBT, and then I want to move on to talking about kind of the intersection with autism and
Mm-hmm.
like the client base that we at AANE serve in particular. But the first general question that I want to ask is, what would you say, like, is the core, or what are the core differences between cognitive behavioral therapy, which is like what a lot of people are used to, it's been around for a long time, and DBT, and like, what is the conversation for why, somebody might use one approach or the other approach? Like what, because they're different modalities, different people have different ideas about what they do and what it means to practice each one. But I think an overview of like, what the core differences are and the problems that they aim to solve are.
Yeah. So with DBT, the like kind of overarching goal is to build a life worth living. And I think, that sort of reflects the fact that typically when people are doing DBT, it's because they have been suffering immensely. And not that you have to have been, or be suicidal in order to do DBT. You don't, that's not a requirement, but that is often, a part of the presentation. That I guess for people who do CBT, that certainly can be present too. I mean, I'm sure it is, but I think that's like kind of one of the things that sort of directs someone towards DBT. And I would say it's just like the more like wraparound nature of DBT is also what sets it apart. Meaning, so there is some like cognitive modification built into DBT that's more similar to CBT, which is like being able to look at your thoughts and kind of recognize maybe if it's not dialectical, like if it's black and white, being able to kind of maybe reframe it more dialectically. Um, but it's not that's like just a small component. So there's more attention paid to, maybe I should just say the four modules. So there's mindfulness as one module. There's interpersonal effectiveness. So building skills in the arena of relationships. There's emotion regulation. And then there's distress tolerance. So all four of those have skills. That's what's taught in the skills group. And so yeah, I'd say it's more wraparound. Like for instance, let's say somebody is struggling with, having a thought like, I'm really stupid. I really messed this up. Um, DBT is gonna recognize that a lot of times people first need to engage with like some distress tolerance skills, maybe to be able to get into a place where they can even, do anything about the thought or engage with the thought at all. So it's like just I'd say maybe a little more scaffolding, and just a focus beyond. Not that CBT is just about your thoughts, because it is a behavior therapy, that there is also exposure built in. Going to situations you might want to avoid or tending to avoid. But on the whole, it is more about like, let's be able to change how you're thinking, because it's not necessarily accurate or working for you. And that's just like a small component of DBT. Yeah.
Yeah, I think that makes a lot of sense. And so, I guess the natural question that we have is like, what is the intersection for our, our autistic and, similarly neurodivergent, um, people? Like, how are they seeing benefits from the usage of DBT, the increased usage of DBT?
Yeah. Well, this makes me want to go back to just what I said a little earlier about like behavior therapy being kind of a loaded term. I just feel like it's important to name that, given sort of controversy and issues, problems, pain that people have had with ABA. I know, understandably, sometimes when people see DBT or hear about DBT or behavior therapy and, are really wary, which I think, makes sense given some negative past experiences. And I think what's really important to know with DBT and ideally, any therapy is that it's really about the client, deciding for themselves what they want to change, and what's getting in the way in their life. So, like, I guess just as an example, I've heard criticism of DBT here and there, not a lot, so I'm not sure how prevalent it is, but that like DBT can promote masking, like sort of in a way, maybe like, I don't know, hiding your emotions, or like just kind of acting as though things are okay, like using skills to kind of, sort of pretend that nothing is really wrong, I guess, like something of that sort. And I would say, like, that's certainly not what good DBT is trying to do. Like maybe that, unfortunately, someone's had a bad experience where that has happened. But it's really somebody, figuring out for themselves what makes my life worth living. So I think as an autistic person or as any person, it's like first coming to figure out, like, what does that look like? Like that can be a challenge in and of itself, if you haven't had a lot of contact with like what actually works for you. But then it's sort of like, building that out, what's getting in the way of that, that's where I guess I feel like something like masking, like I have clients they've tracked masking on their diary card, because they, recognize, hey, this is doing something for me, right? If there's a role that it's serving, it's not necessarily like they're saying, I want to stop this altogether, right? Because we know it has a function, but at least just drawing their awareness to like, where does this show up? What's the sort of impact of that? So that's, I guess, one small example of a way an autistic person might approach this. But I think the main thing is like, aside from self-harm and suicidality, because like life-threatening behaviors have to be targeted. That is a core part of doing DBT, is like making a commitment to stop. Aside from that, it is totally up to somebody, what they're deciding to track. And of course, the therapist can help, it does help like figure out, well, what makes sense to prioritize. But it has to be in the line or in the vein of like, well, this is my life worth living. So, what is getting in the way of that? And therefore, but I want to do less of this and, do more of this. Yeah.
How does the as far as like the masking thing and the and being autistic and like the kind of that layer to it of trying to is it that because you mentioned earlier that there's kind of some like uh discomfort tolerance, like like
Yeah.
teaching and building a skill around like being able to tolerate like uncomfortable situations or uncomfortable feelings so that way you can approach them in like a more measured way. Is that kind of like what people are referring, like where the overlap is? Because it's like sometimes you get into situations and like a lot of the feelings are a lot of it is focused on managing your emotions in that moment and like making yourself available and presentable so that way you can actually tackle the situation and like be available for the situation. Is that kind of the idea behind it? And so like ideally like good DBT is going to encourage an autistic person who's masking to like not necessarily continue, like not that that process and that skill building component is masking, but rather like it's building a sense of like of resilience so that way a person can determine, so that way a person can approach how do I want to handle the situation. Because as we talk about a lot with masking, it's a very nuanced thing. It's not like it's something that can lead to burnout. It's something that can lead to other kinds of mental illnesses, but it's also something that autistic people are using on a daily basis to survive situations, right? So it's like in a way, like the DBT for the autistic person would create a situation where they are able to evaluate, like, okay, how authentic do I want to be in this moment? Like, what parts of myself do I want to share with people around me? And like, what's going to make the situation that I'm in right now, like, worth being in? Is that kind of like is that the general idea of it?
Yeah, I think you nailed that for sure. Yeah, I mentioned before that terms non-judgmental and curious. Again, so mindfulness, I'm sure everyone has heard of mindfulness, but the way that DBT specifically defines it or puts it into skill form is you're building the skills of observing, describing, and participating, and then doing those things non-judgmentally, one mindfully, and effectively. And I'm mentioning it right then because I think all of those come into the picture, but I think the effective, it comes to my mind a lot when it comes to masking, which is like is it effective, for your goal, right? So like in a certain situation, it absolutely could be, right? You're don't have the spoons to like just, maybe disclose in a certain moment or whatnot. It takes more to do that. So if your goal is to just get through the moment, then the effective thing to do is going to be to mask. Whereas if you're looking at another situation or maybe longer term, it's like, yeah, that's probably not effective if your goal is, X. So yeah, it's not, is it good or bad, right? Because there's a value judgment on that. It's really about, does it work for you? Which I think, I don't know, I think everyone can benefit from that, but I feel like autistic people in particular maybe can like appreciate like just that framing. Like, I don't know, it just feels more pragmatic, I guess, in a sense. Like, well, does it work?
Yeah, I mean, I think that those are things that autistic people are regularly thinking about. Like as somebody who runs support groups and has, just like, normal people who maybe haven't even been in therapy before, being in these groups talking about their experience masking, and a lot of it is kind of very relevant to this like process of like needing to be regulated and needing to be kind of aware of oneself and like taking extra steps to be aware of like your body sensations and being aware of your thoughts and how your emotions are affecting your behavior, your outward expression of your behavior. Um, and yeah, I just think that, the way that you've explained it like addresses that really well, like just that whole concept, which is why I think that framing is useful for autistic people because there is always that kind of that calculus that's going into everyday interactions and like being able to build the skill of being able to be resistant to a little bit of being uncomfortable, being able to kind of take a step back and say, okay, what do I need right now in the moment is something that, we talk about in the support groups. I don't know if it's necessarily like, it's certainly not like me using DBT concepts, but I think that there's just happens to be a really good overlap there that's useful specifically for autistic people.
For sure, yeah. That's why I like DBT so much. I mean, because I think it is a lot of it is sort of, I don't know, common sense is the word, but it's things that people often are kind of maybe have found themselves doing or recognize are helpful, but it's sort of part of it's like that it's packaged in a way that's easier to remember. I mean, there's a lot of acronyms, maybe too many acronyms, but yeah, so it's just partly organized and packaged, I think, in a way that people are like, oh, okay, yeah, I can use that skill at this time, but or I am using that skill. Maybe I didn't even realize I was. So I think that's part of the appeal.
I
So,
think,
yeah, go
yeah.
ahead.
No, I was thinking what it seems would be appealing is the structure of it, right? So like there's a very specific structure, and it can be loosened, of course, depending on the needs. So I like the goal orientedness of it, and that it's goals developed by the person, the individual who's seeking out the support, and then you can always use that when you have a goal in mind. You can always use that goal to set your compass, right? And I like the example that you gave, like maybe I do need to enlist masking for this particular situation because it's what's going to keep me safe or it's going to help me get through the moment and I don't have the energy or nor maybe it's not worth the time and energy for this particular situation to invest. And it feels like it includes a lot more choice, right? So I have a lot more choice in these to meet my goal and if I veer from it, that's also okay, but the knowing why I did that and it's more about and I do think autistic folks also from my support groups like very, there's this always this lens on how can I learn more about myself? How can I, respond in different ways that make sense for me or for the situation that I'm in. So I feel like all of that is what lends itself to this modality for sure.
Mhm. Yeah, I'm glad you said that because I've said that and thought that about the structure. I know for some, maybe an ADHD, some people say that, someone with autism and ADHD, maybe like there can be some like some more challenges sometimes around the like this is the way it's done, like it is containing. And of course, like the whole point is like, or another dialectic, sort of balancing the rigidity and flexibility. Like it's like, yeah, there's the structure, and at the same time, like, does it make sense in this moment, or do we need to shift a little? So yeah, I think that, it's definitely not like, okay, you're just going to go and talk about whatever, which I think a lot of people are used to. And for some people, that's great. And there's a lot in between. I don't mean to say it's just this or just talking about whatever. Obviously, there's a middle ground. I guess I've just heard that complaint over time. Like, or even confusion, right? Like people being like, I don't get what I'm supposed to be doing there, like in therapy, like what is this? Which I understand, it can be confusing and disorienting. So yeah, I'd say with DBT that shouldn't really be happening. Of course it can, but on the whole, it's like this is what we're doing and why. So it's very much built on the rationale, which I also think everybody benefits from, but autistic people, maybe particularly so.
So I want to wrap up here in a moment, but I do have one more question before we kind of get to our final wrap up questions, which is like as an autistic person, one of my biggest gripes in being in different kinds of psychology appointments and different therapy appointments over the years is the feeling of like wanting there to be a through line between all of my sessions. The feeling of like, okay, like this week we came here like a lot of the time the feeling would be like I would go and we would talk about one thing and then we would just go and talk about another thing. It would be this very disjointed thing. And like eventually as I got older and I learned more about the process of doing it, like on the side of the therapist, I learned that it's like they have a very holistic picture of what's going on because they're taking notes and they're thinking about it and like that's part of their job. But there's this feeling that I had as the client and maybe like as an autistic client is like, you know, I didn't feel like I was participating in that like larger, more zoomed out view of it. It felt like just kind of showing up and like giving the therapist information and that they would kind of like operate indirectly. And it sounds like DBT is more of like you're kind of invited a little bit more into that zoomed out process and you're being shown a little bit of the mechanism of what's happening in it and like being allowed to participate in that, which I think for at least for my autistic brain, that sounds really nice because it's kind of like, I get the feeling that there is this through line between sessions that we're kind of working toward this like specific goal or we're building a specific skill or we're at least processing a specific feeling or a specific emotion. And that seems to make a lot more sense. I mean, I can see why the other one would be important too. Like maybe, having all the wiring underneath exposed like might be kind of overwhelming for some people, and so they would prefer to kind of just do like the one-off interview style. But you can see kind of like where the different preferences are like, are useful in different situations.
Mm-hmm.
So I kind of just wanted to add that because I do think that, DBT is becoming an increasingly popular modality, especially for autistic and similarly neurodivergent people. So to kind of wrap things up, I guess the question that I have is like, what should people kind of look for when they're looking for a DBT therapist,
Mm-hmm.
especially our autistic client base?
Yeah. Yeah. So I think guess maybe similar questions that I would recommend, whether it's DBT or not, like just in generally hunting for a therapist. Some of which I know we have in our other, we have in our presentations. I'm kind of pulling from that. But I guess really just asking, like, can you tell me more about your experience? You're training with DBT, like that's an entirely valid question to ask. I know if you don't have a good sense of what the different kind of training levels or options are, it might not mean a whole lot to you, but it could give you more of an idea. Yeah, I'd say like maybe can you certainly talk about your experience like working with autistic people or how DBT, and autism, go together. Like I kind of similar to I know what you've expressed, Ryan, previously. Like I don't think there's any like wrong question to ask because I think what response you get is information, right? Like how the therapist responds and not to be like super critical of them, but it's just useful to see, right? Like what do they make of this and how willing are they to try to answer? I mean, I don't think it's useful to expect them to have a perfect answer. I know I might be asked a question, and I'd be caught off guard and be like, oh, I'm not sure. But even just that, right? Like the willingness to be like, oh, I don't really know. Let me think about that. Like that tells you something about the therapist as opposed to maybe that like coming off as like, oh, I need to know everything. I'm kind of like in the expert role. I'll just add that DBT is really about like a relationship between equals. I mean, acknowledging like, of course, there's a power dynamic because how can there not be? You're in this professional paid role, but it's really about trying to your point before about the transparency, and like I'm teaching you what I'm doing. Like I'm not keeping the stuff in my brain and hiding it, like or whatever, being mysterious. Like it's trying to make it more explicit. So I wanted to say that, but yeah, let's see now what else. I got off track.
I mean, I think that's a good answer. Like, I think that, those are definitely some good questions that people can ask as they are, looking for a therapist that's a good fit for them. So I think that that's like a really good core kind of takeaway from it for people who are in search for a therapist and who are interested in using the DBT modality. Um, And if somebody wants to like learn more about just DBT and what it is, like where should they go to do that?
Yeah. Well, so I know I had written an article for our newsletter, I guess it is, that will be coming out. So that's one place to get some more, like some of what I'm saying is in there, but then also I list some resources at the bottom. So that'll be one place. Yeah, I guess there's, I'm thinking because there's plenty of good information out there. I just don't know the best way to share it. I guess look for it in that article. Obviously, people can reach out to us, as always, and um, I'm happy to talk with anybody further about this. Yeah, I guess that would be what I would say. Check back with us.
Yeah, I think people can certainly look out for that. And I think that we've covered a good amount of things here, so I think this is a good place to leave it. But thank you, Kelly, for taking the time to talk to us about this really important subject, this increasingly important and relevant subject. Um, and I know that there's a lot of other content we're going to be producing this month about this particular about this particular topic of different modalities and different therapy modalities and things like that. So thank you for being part of that. If you're watching the video and you have any comments or you have any questions or concerns or anything, feel free to leave them in the comments. And thank you for watching this video, and we'll see you in the next one.
Thanks, Ryan.
Bye, everyone.